Jessica Monje CORIA, and welcome to the second webinar in the Investing in the Future of Childcare series, hosted by the Federal Reserve Bank of San Francisco's Community Development Department and the Low Income Investment Fund, also known as LIFT. Our goal over the 4 webinars is to explore the challenges facing the childcare market, as well as the investments and partnerships needed to support childcare providers. These events are designed to advance understanding and action in the field, and we will also work with communities across the 12th Federal Reserve District to support stakeholders who are committed to boosting the capacity of the childcare system and to identifying solutions that benefit both children and working parents. Today, we will delve into the topic of workforce, both the educators who work in the childcare sector and how that care allows parents to thrive in the labor market. This webinar is being recorded and will be made available via LIFT's YouTube channel. For those of us who enjoy live tweeting like me, please use the hashtag #InvestInChildcare. We are aiming to have plenty of time to answer questions from you, so please utilize the chat and Q&A functions throughout our time together. Now I have the pleasure of introducing our panel, beginning with Dr. Ashley Williams, who is the Senior Policy Analyst at the Center for the Study of Childcare Employment at UC Berkeley. In her role, she tracks, analyzes, and translates state and national ECE policy development, with a particular focus on issues related to the early education workforce. I would also like to welcome Kelly Middleton Banks, who is the Manager of Program Implementation at the National Association of Workforce Boards. In this role, Kelly is responsible for providing technical assistance, designing programs, developing content, and establishing partnerships to support workforce development boards in implementing strategies and best practices to advance workforce and economic development, both locally and nationally. And we are also lucky to have NIHDI MIRANI, the founding executive director of CORIA, a partnership-based technology nonprofit organization that builds online tools to bring good jobs to care workers, so care workers can provide the best possible care for those who need it. CORIA's safe, simple, and informed care matching platform has successfully matched over 4,000 care seekers and providers, working in partnership with labor, government, and community organizations. Before I turn it over to the panel, I wanted to take a moment to provide some data for context for this conversation. In 2019, parents with children under 18 represented nearly 1/3 of the workforce. 2/3 of children under age 6 have all available parents in the labor force. There are also important race equity implications to keep top of mind today, including the majority of young children are people of color. Black and Latino workers, women in particular, are disproportionately represented in the lowest wage jobs relative to their size in the labor market, and more than half of Black families report difficulty in finding childcare. Among licensed childcare professionals, both in-home and center-based providers, 40% are people of color, and nearly all childcare workers are women. These data points are all in Childcare COVID-19 and Our Economic Future, a research brief written by my colleague Bina Shamali. Also, today's webinar will be focused on licensed childcare settings. Many families do use informal or unlicensed childcare, also called family, friends, and neighbors, but that will not be the focus of our conversation today. Finally, we must acknowledge that we are talking about childcare during a global pandemic, one that has exposed inequities across the labor force, specifically in who has been deemed essential workers and been provided additional support, PPE, and safety precautions, and those who are expected to work but who have not been adequately supported. We'd like now to show this video featuring Nasinette Palos, owner of Cool School Daycare in Santa Clara. She shares her experience over the past 7 months as a childcare provider.
We as daycare providers or family childcare providers, not only do we provide meals, take care of kids' needs on a daily basis, nurture, encourage their imagination, and prepare them for school. if we don't have any, if we're not treated as essential workers and provided with the support that's needed to pay our daily bills, to put food on the table, to support our families and the children and their families, so the parents can go to work and the children are safe with us. If we don't pay for a mortgage, we don't have a house. There is no way we can keep our doors open if we don't get the financial support. And Lyft has done that for me and many other providers.
Thank you to Liv for providing these video stories. And Nasinet is referencing the Lyft COVID-19 relief for ECE providers effort that provides emergency relief grants to New York City, Washington, D.C., and the San Francisco Bay Area. And now on to our panel. First, I'd like to start with Dr. Williams. Tell us a little about the Center for the Study of Childcare Employment, and why has childcare educators been historically treated different than their K-12 counterparts? And how have we seen this specifically during the COVID-19 pandemic?
Thank you so much, Jessica, for having me in the Federal Reserve Bank team. Today, I just want to say I really appreciate the vision for this panel and inviting me to bring the perspective centered on the ECE workforce. As I understand that the goal for today is really to talk about boosting employment for families and sustaining their participation in the labor force, it's really critical, as you pointed out, especially for women, as we're seeing increased reports of them actually dropping out of the labor force during the pandemic. And, you know, we know that child care for young children and children in K through 12 settings, yeah, I said it, child care is happening in K through 12 settings, but it's critical for families to really be able to have access to care and education so that they can return to work and school. So, you know, today my position on this panel is really to extend that conversation on supporting families in the general labor force with ECE services by centering and emphasizing the realities of early educators who are doing this work. Ultimately, we can't talk about supporting the general labor force without understanding of the inequities forced upon the ECE workforce. To do so actually would deepen those inequities for a workforce who deserves and requires support as they do the important work of supporting learning and development of our nation's youngest learners. So in our work at the center for the past 20 years, we've been conducting research and uplifting policy solutions that focus in on how the workforce is prepared, supported, and compensated. And so, you know, to the question, ECE, we know it. It's a critical period of human development. We know how important it is to support positive effects on children's social, emotional, physical development. We have that information. We also understand that not only is ECE the crux of human development, but it's also the underpinning of supporting the general labor force. Yet somehow we see the treatment and lack of respect for the teachers of our youngest children who are doing this work, and we're seeing them being invisible and devalued as a workforce. To be clear, we have a deep history of undervaluing labor performed by women and people of color in this country. A prime example of this is the treatment of enslaved Black women in this country who were expected to take care of white children with priority over their own in deplorable and dehumanizing conditions. And this was the foundation of which childcare was developed and what we know it to be as one of the most underpaid professions in our country. And early educators earn median hourly wages of $12.12. In every state, educators are amongst the lowest paid workers. We have found that early educators experience poverty rates at 4 to 14 times higher than K through 12 teachers, depending on the state. Further, just to really kind of paint the picture of the harm that's happening across different settings and job roles, Black educators are paid on average 78 cents less per hour than their white peers. And that pay gap widens when we look at the age of the children that they're working with. So the younger the child, the lesser the pay. For example, among center-based teachers, those working exclusively with infants and toddler full-time earn about $8,000 less for their work than those who work with preschool-age children. And so specifically, this is particularly harmful to Black women in centers and those of their peers who are working with infant toddlers, and also to Black, Latinx, and immigrant women who are working in home-based settings where a large share of infants and toddlers are served. When it comes to family childcare providers, 59% of them are in households that have incomes less than the national median, and that figure is 75% for Black educators. And so I point this out to say that this is a policy issue, but it would be irresponsible for me to not acknowledge the fact that we're also dealing with a second pandemic in this moment, a chronic disease of racism and racial reckoning that's playing out right in front of us. And ECE is not exempt from that. So we really have to interrogate all the ways in which systemic racism is actually kind of coming into play. And I point that out to say that 40% of the ECE workforce are women of color. This is a huge contrast through K through 12 workforce, which more 80% of them are white. So during this pandemic, we're all struggling, and we've seen increased expressions of gratitude. I'm sharing my screen with quotes from early educators themselves to really serve as a backdrop for what I'm saying here today. There's also a QR code if you want to find more about our work. It'll link you. If you use your phone, it'll take you directly to our website. But what we're hearing from educators is that they've continued their work without proper support, PPE, cleaning supplies. And we found this in our research, specifically in California. Yet, we're seeing increasing gratitude for educators and folks doing this work. But frankly, appreciation doesn't pay the bills. Appreciation is important, but it's insufficient to address the realities of inequity that I just painted that the workforce is dealing with. It's only just been heightened by this pandemic. And so as you can see from the quotes on the screen, our workforce is feeling invisible, they're feeling expendable. And in these discussions I've had, they've expressed their fears for their lives, their safety, their health, their concern for ECE as a system, and the realities that they're kind of grappling with the dominant narrative really focus on supporting families as if they don't have families of their own. And so they find it really frustrating that there's oversight of the fact that they too need support. We see this loud and clear with the treatment of ECE in childcare right now, as K through 12 schools are closed, childcare is open, and many states have never shut down. And so, one of the questions I pose is what makes the ECE workforce any more immune to this disease than K through 12? And so my hope here today with this, the panel and this opportunity is for those of you out here listening and exploring ways to retain and return your workforce, that these efforts can't be absent of consideration and protection of the early educators who are doing this work.
Thank you so much. That was an amazing way to start this panel, and I am sure many of you have a lot of questions. So please get those going in the Q&A and the chat. That's why we wanted to reserve lots of time at the end. So thank you so much, Dr. Williams. So I work in the Southern California region, which is home to 24 million residents. I just recently added it all up. Kelly, I wanted you to talk a little bit about what resources should local workforce development boards be connecting job seekers with, specifically parents, and how can you possibly share a community that has been successful in expanding their network of resources?
Sure, and thank you so much, Jessica, for having me. I'm so happy to be a part of this panel. Just a quick background about the National Association of Workforce Boards. We represent the 550 workforce boards across the country to advance workforce development, mostly funded with WIOA funding from the federal government, as well as some state and federal funds. There's most likely a workforce development board in your area. I highly recommend that you reach out and connect with them. One of the pieces that I think workforce development boards they're very well positioned within the community as being an organization that's business-led. 50% of workforce development boards are business-led, and the other remaining members are part of the community, your community colleges, your educators, your other partners and stakeholders. Workforce development boards, on top of providing job skills and training, they also provide supportive services to those job seekers and workers who are looking for to advance in their jobs. And those supportive services can be connections to housing information, transportation, scrubs and work boots for your job, but also childcare. And childcare continuously has been a challenge for many. For a job seeker or someone who's recently obtained a job, they have the job, but now unable to maybe stay on the job or take the opportunity because they don't have the necessary childcare. So in 2016, we decided to start an initiative with some funding from Kellogg Foundation and partners to really advance 2-gen strategies. And some of the institutions and workforce boards that we've worked with to do that work have really taken up the mantle. I mean, one of the things we really stressed was that this is a systems change as you try to connect individuals with partnerships and with resources. One in particular was Maricopa County in Arizona. They really embraced what we call the Family-Centered Employment Initiative and the 2-gen strategies. They're based in a Health and Human Services Administration, and they really worked on getting buy-in from their leadership. They trained their staff to be able to better support families, to ask the right questions. And then they took that training and then trained the remaining staff in Health and Human Services in the county to be more equipped. And through those efforts, they were able to help job seekers, help working families not only gain in placements, but be retained on their jobs because they began to connect them with the necessary supportive services and childcare opportunities that are in the community. Another one is Lake County, Illinois. They worked with a partner because we really stressed that as a workforce board, you don't have to be the lead of this work, but you should be at the table. And it's important to partner with your community-based businesses and organizations and other stakeholders. So Lake County, Illinois, they're working with the YMCA to do a childcare scan to identify childcare deserts. So as a network, they can be better equipped to deploy the appropriate resources and create the necessary supports for the job seekers and those in the community. And last but not least, Northwest Wisconsin Workforce Investment Board. They manage 10 counties in the Wisconsin area, and they saw a need, that there was a need for childcare. And working with economic development, they oversaw the inception, development, and construction of a childcare center. It opened last year, so this month marks a year of their childcare facility being opened. It has 94 slots, with 51% of the enrollment available to children from families at 185% below the federal poverty guidelines. And now they've been contacted by other employers in the community that are interested in doing this work. So workforce development boards are really positioned in the community due to the fact that they are business-led. They have a lot of the stakeholders in the community to be able to make those connections and better support parents and working families so that they are being able to access childcare, not just good childcare, but affordable childcare, which is so important. It does make an impact on the workforce in those communities and the overall economic development. So it's necessary for workforce boards to be a part of that conversation and play a role in that work.
Thank you so much, Kelly. I think, especially as we keep talking about getting back to work and how important workforce boards are going to be in that process. And if we bring them in early about the need for childcare as we begin that process of bringing people back to work, it's really important to bring them in as what we would like to call non-traditional partners. So thank you so much for that. Okay. Let's let's shift to NIHDI. We're so happy you could join us because Karina really brings these two populations that Dr. Williams and Kelly were talking about today. So really about how Karina is, what is it, and why do you focus specifically on family child caregivers?
Sure. Thanks for having me here today. So I wanted to start off with, Karina is a nonprofit organization. Our vision is around a care economy that strengthens care workers, families, and all who need care. And we've, from the beginning, recognized that success is totally mutually dependent and intertwined, and it's not, a zero-sum game. And so a lot of our focus has been on that. We started out in 2016 when home care workers in Washington state bargained with the state to have a way to access full-time work. And so, we had spent basically 2016 to 2018 working on how to build technology that can help address some of the issues that they were seeking, right? So on the home care side, there's a problem around finding a client when you lose one. And so this is Medicaid funded low-income population throughout the state. And there were about 50,000 consumers, home care consumers, and about 40,000 home care workers. And so we spent 2 years trying to build a technology that was accountable to these populations. And so we learned a lot. We had done things around data privacy, so making sure people were not forced to share their information until they were ready, having matching that was based upon public transport and not only car time, just a whole bunch of stuff, nuts and bolts. We had started talking with childcare workers who had reached out to us, so labor organizations representing childcare workers in 5 different states, and they were interested in a similar kind of tool to see if they could take advantage of that. And so, we'd been looking at the 2 sets of workers, home care workers and childcare workers, and noting all the demographic similarities, right? So I think Dr. Ashley in her introduction talked a little bit about that, but certainly women, disproportionately people of color and immigrants, and all of that was all the same. But there was a bunch of other stuff that was similar between the 2 populations, certainly low-wage workers, undervalued, and basically not even recognized as real work, right? And so that it was very, very similar. When we started looking at the pain points to make sure we were going to be able to address and solve the similar pain points, that's where we saw a lot more similarity. So one of the biggest issues I think around income is that even if you increase reimbursement rates or wage rates, without having access to full-time work or full occupancy, you still can't make a living, right? And so on the Medicaid side, what that looks like is the unions were able to win $16 starting wage up to $22, $23 an hour. But if you only had 80 hours of work a month, that didn't, add up. And for a childcare for licensed in-home family childcare providers, it's a similar issue. You have a certain number of slots, and if you can't fill them, even if you had a great reimbursement rate, it's not going to get you to a full-time sustainable income. So we noticed that there was a similar pattern happening, that even if labor was able to achieve victory on reimbursement rates and wage rates, that really we're still going to have this outstanding problem. Secondly, both sets of workers, licensed family home care workers and home care aides, are the most affordable way to get care in their communities in that part of the world. So compared to nursing homes or other options, or compared to maybe center-based care, these family-based home care providers is one of the most affordable options. So that was also really similar. And finally, that they were all under-marketed. Like nobody knew about them. They didn't have budgets, like institutional budgets, to get the word out. We surveyed recently about 500 family childcare providers, and 90% of them engage in virtually no marketing. They all just rely on word of mouth and hope that that can get them to where they need to be. And so that was really a lot of similarity. So we've been, talking with labor organizations about a potential solution, and then COVID hit. And I started getting calls from a lot of people in the tech community who we had incubated with and worked with early on at CORIA. By this time, so by the time COVID hit, we had matched thousands of home care providers. And so we had some legitimacy with the tech community. And so they wanted to volunteer. They were all up in the air about restaurant workers, all the restaurants are going to close, and it was going to be, you know, neighborhoods, and there's not, you know, and they were very focused on that. So they called me and they're like, we want to deliver food from restaurants to frontline healthcare workers. Can you help us do that? And I was like, yeah, I can connect you to people. We can make that happen. But, you know, I said, there's this whole invisible part of the economy. And they're going to get, like, you know, they're already devastated, and this is just going to destroy them. And so we were able to partner with VMware Pivotal Labs, which is a large technology company. They donated engineering time to us, and we started engineering on March 16th. That was the day that many of the schools were closed around the nation, California, Washington, a bunch of other states, that mid-March point. And by early April, we had a platform that was available to the providers. We had overwhelming response. Over 2,000 providers signed up immediately. So these are licensed family childcare providers. And then we started reaching out to parents. And, you know, I can talk a little bit more about that if we want to explore the labor connection later on. But since then, it's been, you know, it's just been like a lot of what everybody's saying. Like, the pain felt on both sides of this equation is significant. And, you know, wherever we can help solve and mitigate some of that pain is really important. I will note, like, obviously the financing remains one of the largest concerns underpinning all of this too, though. So I'll stop there with my opening comments.
Thank you so much. Yes, money, that definitely keeps coming back as a big need, and why I think we named this initiative Investing in the Future of Childcare, because that's what we need. We need investment in this sector in order for it to work. So going back to Dr. Williams, so the importance of protecting childcare educators will continue beyond this pandemic. So can you talk about some places that are working to ensure that childcare educators are being adequately supported? Any
Yes.
bright spots out there?
Yes. So I think there are lots of bright spots. We've seen, you know, multiple efforts from states or cities that have tried to support the ECE workforce. When I think about a particular lens on the pandemic, we've seen in states like Alabama and Washington, they've rolled out childcare stabilization funds to help keep programs afloat, because we know that childcare is on the brink of collapse across the nation. We've even seen states like Indiana, Iowa, and Kansas, and a few others that have funds, stabilization funds, that are earmarked specifically to make sure that there's a continuity of pay for childcare staff. I also will say not enough states are doing that. Also, for examples, we've seen in North Carolina, Wisconsin, they've provided hazard or bonus pay for folks who continue to provide emergency childcare and services to essential workers. And we've also seen New Mexico, they've provided state-funded insurance for uninsured childcare workers and their families if they test positive for COVID. So when I think about a lens on the pandemic, these are some bright spots that we've seen. Again, the impact, you know, we'll know. We're collecting that data and looking at that within our organization. Prior to the pandemic, when I think about some bright spots of how we've kind of approached supporting the workforce, I can think about the lens through New York, for example, who has committed to parity pay for preschool teachers. And so I think that's an important bright spot and an important step. And when I think about kind of some of the inequities that I laid out, we also kind of have to keep in mind that these efforts or that effort, if it's getting at one aspect of the workforce, it doesn't actually or inherently solve the issue of compensation, specifically, as I pointed out, for infant toddler teachers, and let alone for the family childcare sector. So, you know, I think one of the things that, you know, as, you know, programs, businesses, policymakers, advocates, as we think of ways to support, you know, families and support the workforce, we're in a moment where we kind of have to accept the fact that our solutions, they have to kind of evolve from our understanding of what childcare was prior to the pandemic. And so when we see these efforts, such as like New Mexico kind of figuring out state-funded insurance, what aspects or what have we learned that we can kind of bring into imagining a more equitable system that actually gets at these issues, especially particularly compensation for the ECE workforce. So that is my offering there.
Oh, yes. And I really want to emphasize, we don't want to just rebuild the childcare sector because it was broken to begin with. We want a reimagination of what it can be like. And really in order for it to survive beyond this pandemic and beyond. And the other thing that I always find hard for people to remember that you don't really think about is part of the reason why toddler and infant care is so expensive is because of the requirement to have fewer children per provider, yet they're still being paid less, partially because of that requirement, but also because for whatever reason, it's not valued the same way as, oh, I'm teaching. And I really appreciate your view of calling our providers childcare educators, because they really are more than just providers of care.
Thank you, Jessica.
Okay. So back to Kelly, we've gotten a lot in the chat about, wow, Maricopa County sounds like they're really, kind of taking this on head on. And there's been some other great places that you mentioned. How were you guys able to kind of convince your local workforce development board that this was something that they should be spending time on and kind of overcome that tendency to say, you know what, this is not my problem. My job is to get our job seekers, employment and help them retain the employment. I'm not supposed to figure out where they send their kids during the day.
And Jessica, you nailed it right there. Their goal, their focus is to support businesses so they can have a viable and skilled workforce. And they're supposed to help job seekers and those who are employed to either upskill or to attain a job. But that's really difficult when, one of the major challenges, especially for working families, is they don't have available and adequate childcare. So as I mentioned earlier, you can find the job, you can train them for the job, and then they take the job, or they choose not to take the job because they're unable to have quality or available childcare. And so for workforce development boards, I think it started to, especially even now, they had to really recognize that this was a major part of them ultimately meeting their goals. So investing the time, investing the energy into making those connections. As I mentioned, workforce boards are not necessarily equipped to, handle childcare, but there are people in the community that are. And so it's really about connecting with those individuals and connecting with those resources to make those available. One of the things that we did through the Family-Centered Employment Initiative, which we started off with 3 sites, Maricopa County being one, the other 2 were El Paso, Texas, and Montgomery County, Maryland. Was starting to get some lessons learned about what were the challenges, where were the pain points in trying to address this for those who were looking for work. And then from there, we expanded that to 12 additional sites across the state in the community of practice to really share those strategies and best practices. And what we found was that it was so important to get buy-in and leadership from the board. The Workforce Development Board, it consists of 50% of business leaders in the community. So getting a champion that's a business owner or a part of a business, not only trickles for the workforce development efforts, but for the overall efforts on advancing and investing in childcare. So once that buy-in and leadership is established, then it trickles down with ensuring that the workforce boards are removing barriers and not creating barriers for parents to be able, and working families to be able to be successful in job placements. So really understanding how to, work with parents, identify what their needs are, and then partnering with community stakeholders to address those childcare issues. And then also having the conversations with employers. Workforce development boards, that's the bread and butter. They are constantly in conversation with businesses in the community. And if they're already thinking and working and investing in childcare and then the value of childcare, why it's so important, then they're already, and because they're already talking to businesses about how do I help you meet your workforce demands, they're very well positioned to have the conversation shift to why there needs to be investment in childcare. Why does there need to be a focus on that, and how with a network, those supportive services can be put in place to where their workforce could be successful. One thing we have noticed is that there's a lot of employers that have come to us who've expressed that we recognize that there's a gap, that I want to put my my employee through a specific training, but they can't access that because the child care is not available for them to do that. And so they're looking for support and looking for assistance in this. And even now, in the midst of this pandemic, workforce development boards are consistently asking, what are other boards doing and to address this? Because it is a challenge, but there has to be an investment. And having those business leaders on the workforce development board that is championing this work trickles out throughout the community, and then it can make a difference. So that's kind of how it has moved across the system. And we're continuously working and providing information and resources for the boards so they are able to be equipped to have those conversations and build those relationships.
And I think it's important to note that this is one thing where we can actually use the pandemic, as an advantage, right? Because it might be one of the first times employers are really going to have to think through how they're supporting their employees in the aspect of childcare, where for a long time, it was kind of like, everyone's just going to have to figure it out on their own. But this might be an opportunity to really engage them as to why it's so important, and because they might actually be suffering it themselves, right? They might actually be at home without childcare. Okay.
And
thank
Jessica,
you so much.
one quick thing, and I know you're turning to NIHDI. What NIHDI has done is amazing, and it's definitely a resource that workforce boards and working families and other agencies would greatly appreciate, because they're looking for that information, looking for that resources. So I'm so happy NIHDI's here to talk about all the effort and work that they've done, because it really does make an impact, and it helps those individuals who are trying to find those placements. So it's exciting.
Yeah, it's really a tool. So yeah, coming back to NIHDI, CORIA is committed to working with labor unions and supporting unionized care workers. So how has that platform created opportunities to support both working parents and childcare providers?
Sure. So I'll start off with just like none of this is in a vacuum, right? We're all in a system. And I would just say like some of the most exciting organizing victories over the last few decades has been this group of women, right? Like childcare workers and home care workers. And in California itself had one of the largest labor organizing victories with the family childcare providers. I believe 43,000 of them now have a right to bargain with the state. And both of these industries around home care and childcare have had similar challenges, like who's the employer and how do you define it and all this kind of stuff. And so on the flip side, for parents, I think as they've thought about, their approach to work, it's clear that between being the sandwich generation with people with care needs for both young and old, that the workers of America are, being stretched like never before. And the worst joke I've heard is a legislator who said, oh, the best way to solve the care crisis is to have a great daughter-in-law, right? And so like, it's still not even being really taken seriously, I feel like, in the way that we need it to be nationally to solve this crisis. And so labor, I think, has constantly had a drumbeat around this that's been, turning into really great larger organizing victories on both the provider side, but also on the parent side, and thinking about how you demand systemic solutions around this stuff. So in terms of the labor partnership, what it provided early on was that it just gave, a tool like ours access to both sides very quickly. So many of the childcare unions also represent other essential, like, in the early days of COVID, right, when it was only essential work, they represented a lot of the essential workers. So they were seeing pain throughout their constituency. And so that was a very quick way, an efficient way to get in and match. So for example, one of our first parents was a social worker from Southern California. She had to find childcare for her son, her young son, I think he was like 8 months old, during the pandemic. So as you all know, it's hard enough like not in the pandemic, and now you're like, oh my God, is it safe? Like, what is the protocol? How do I even get to know this person? So she got on and was able to find Helena, who was like a very experienced 25 years experience family child care provider just a few blocks away from her. And that match has been going successful. But again, they were both within the same, they were both within the same union, which made it easy for us to get the word out, very cost efficient, very quick, easy to reach. The second level has been extending that to the employers. So Kelly, like, I am very excited. It's on my notes, follow up with Kelly out of this meeting. But one of the other great relationships that, partnering with labor has brought is the other employers. So for example, very quickly in California, we were able to reach out to Kaiser. So, the childcare locals contacted their sister locals who put us in touch with Kaiser. And it was very timely because Kaiser was introducing a stipend that had just been bargained for all employees to provide emergency childcare. So it's a nice combination because you had the financing solved temporarily, at least for a period, and then you had the tool to find family childcare near you, right? And so that was a nice combination. And we were able to work with that. Similarly, Mayor Garcetti had an early initiative on emergency funding for frontline hospital workers. And so we were able to get introduced to him, and then he got us to talk to 8 hospital HRs. So I agree with everyone. Like, I think that as we think about both sides of these equations, we have to think about what are the institutional supports, whether they're workforce boards, large employers, associations of small employers. How can we reach them in a way that is trusted, and in a way that comes to them where they are, so that, where they're getting information. So with Kaiser workers, they were able to get information not only on, if they needed an emergency hospital because they got exposed to COVID. We were on the same platform if you needed childcare, if you needed, all these kinds of supports. So to think about that worker support package holistically. And then finally, I think really it comes down to accountability, and whatever. A lot of tech, I think, has struggled with how to be accountable to the populations that it serves. To me, it's not a surprise that there were no solutions in the Medicaid home care space to solve this problem. And it's no surprise to me that family childcare has not been a focus. I think there's a lot of platforms out there where you can find nanny care and other types of care. And so I would just come back to that. It's like, who are you accountable to? Like, what's our results? How are we thinking system-wide? Because I can make it as easy as possible for you to find a family childcare provider near you, but if you can't pay for it, what's the point of it? So I just I love the focus of this panel because it comes down to, the history of where all this comes from, all the way down to the nuts and bolts of like, how are we going to enable people and be accountable, so that we can provide like successful care for everyone who needs it in a way that's safe and affordable. So I'll stop there. I mean, it's just like such a labor of love to do this work. And I know that's the case for every panelist here. So.
Thank you so much, especially highlighting the fact that for so often we have made it's someone else's problem. It's parents' problem to figure out where they're going to put their child during the day that's safe and affordable. It's the childcare provider's problem to find parents and fill those slots so that they're able to have a full roster. And that can be very frustrating because it doesn't seem like anyone is being held accountable or being responsible for what is really important public service that should be invested in. So I have a few questions. Thank you guys so much for being able to provide some questions. And some of them we have answered in the chat. So please check the chat just to make sure we didn't already answer your question there. We talked a little bit about this, about how some of the companies and organizations who are trying to, quote, do something for their employees have been able to partner with organizations like CORIA. I think that's really important. And we had another good question that I was going to open it up to the panel to see, is there anyone who can provide a good example of private business sector investment in childcare, in the childcare market that we could highlight? Anyone have a?
I mean, the one I mentioned comes to mind is Kaiser. I mean, off the top of the bat, like very quickly, within a few weeks, they were both at the bargaining table and they were setting up. They had assigned Dr. Sarita, Mohanty is her name. So she's a senior VP, and that's who they put in charge of their employee supports. So I also think like that was a good sign that they had a senior leadership person who was, and she was like setting up their call center and she was really in the nuts and bolts, but that was a really great sign. So I think it's both like, can you bring the finance, but can you also bring the leadership in your organization to say like, like we need to solve this because this is not like small potatoes and somebody else's problem, like you said. So Kaiser comes to mind. The other thing I think it's interesting is when a government, like a local government, like Mayor Garcetti took 8 hospital systems and brought them to the table. And so that's the other thing I think is particularly interesting is how can other people, like the workforce board sounds like you do a great job, but what is the convening entity that can, create the prioritization around this? Because it's probably especially for smaller institutions, it may be hard to like set this up very quickly. So, what is our systematic approach to that? But Kaiser is probably one of the biggest examples I've seen of a private investment in this.
Thanks, Dizzy. Dr. Williams, how about on the public side? Has there been some policy wins at all recently that you wanted to highlight, or policy that you're currently working on to kind of move forward and related to investment specifically as it relates to increasing potentially the pay of childcare workers around either the pandemic or moving forward?
Right, and some of those states I kind of highlighted as bright spots, and I will kind of point back to, the effort that was happening in New York with the commitment to parity for preschool teachers. So I think that is a good step, a good stride. What we're seeing now, lots of policy recommendations are on the table are about parity with K through 12 educators, for early educators, for the workforce. When we think of parity, we're also thinking of pay and the types of benefits that they have access to for similarly qualified ECE workforce. So I think that there are numerous states that have, I think even the evolution over the center's work that they've been doing over 20 years, speaking of compensation was not a popular topic in ECE. So it is, I think, a win now. Multiple recommendations that I've been seeing come out from folks really are elevating and highlighting the need for compensation. Even what we're seeing in some of the stuff that is on the tables where it's not moving on the federal floor as we need it to right now, but we're seeing just, the Child Care is Essential Act. We're seeing it at the federal level that there's a heightened awareness of, the service of childcare and the importance of it. I think that, it varies among states. And I think, again, some of the things that I pointed out is that in these efforts, we really have to kind of be mindful about, as they are critical steps, being mindful that they aren't deepening the inequities that already exist. So these efforts, again, still can't be absent of the realities of issues of compensation, lack of healthcare that the ECE workforce is faced with. And lastly, I will say, I think one of the things that we've seen, even in the discourse around invest in childcare and efforts about childcare, we see a highlight on families and access, which is absolutely important. I'm not negating that at all. Yet we have to make sure that these efforts or policy recommendations and solutions actually have drivers and benchmarks to ensure that there is a livable wage built in for the workforce. So we've seen lots of efforts kind of roll out, yet there's not a trigger for actual compensation. So something to get into the pockets of the people that are doing this each day.
Yeah, thank you so much for that. I also remember that NIHDI mentioned that some of the in-home care providers were receiving hazard pay, but it hadn't been extended to childcare providers. So we're seeing that lack of parity continue even during the pandemic, which is incredibly frustrating. I wanted to just address some of the questions here real quick. One was a very good resource for families looking for childcare are the resource and referral child development agencies, and those are very they're throughout California, but I don't actually know, I'm from LA, I don't actually know if they are in the other districts or the rest of the 12 districts. So that's something for us to definitely think about. But for those of you looking to connect with childcare providers, the Resource and Referral Child Development Agencies in California are also a really good place to look. And then another question that I wanted to make sure I addressed was, why are we only addressing this conversation in the framework about who can watch our children as opposed to the benefit of quality early education? And I just wanted to take a moment to explain, we actually purposely chose this framework because there has been so much already done, and especially by our colleagues at the Federal Reserve of Minneapolis, about the advantages of investing early in quality early childcare education. So we were trying to take it from a different perspective, where we really felt that we have not explored enough about workforce issues related to the sector of small businesses. And you'll see in the following two webinars, we're continuing kind of talking about other facets of the sector beyond why it's important to invest. But I do agree that's important to always highlight. I assumed we all knew why it was so important to invest, and is partially why we're here today. And then I don't know if there's a database of what childcare benefits are included in different labor markets. If anyone has any information about different, it's really hard to actually create listings of things in this particular sector, is something I have learned. NIHDI, actually, before I move on to the next question, just give us a little highlight of how easy you've made it for providers to join CORIA, and how they update you, and why you did it that way.
Yeah, sure. So this just goes back to the accountability, right? Like at the end of the day, I go up in front of elected leaders, people who are providers themselves and parents, and have to, like, with a straight face say, look, this is actually easy to use. And so one of the things that we thought about, especially when coronavirus hit, everybody, everybody's really busy and fatigued before, and now is just like overload, right? In terms of that, all the things people were trying to manage. So one of the things that we've done is that for providers to sign up, it's less than 4 minutes. We clocked it. You can get on, get verified, put in your information, set up your profile, all done, 4 minutes. And then you never have to log back in again, ever. Because we just text you. We send you a text once a week, and you just reply yes or no, and let us know if you still have openings. We don't want you to be on the computer any longer than you need to be. Like, I'm not clocking you to add time. I'm not feeding you other information. But more importantly, like, it's being sensitive, to how people really interact, and all of that. And then for parents, we've clocked it. It's less than 2 minutes. So you can get on, put in like 3 pieces of information, find it, and hit connect. We've done a lot around data privacy. So I think the state R&R networks are great, and they've done a really great job. For family childcare providers in particular, they can't actually show you their information. So you do need to do a phone call, and then they'll facilitate that interaction. What we found on CORIA is that most people who are searching for care do it between the hours of 6 p.m. to 10 p.m. at night. That's when and you think about it, right? You've worked all day, you get home, and you're like, look at my list of things to do. It is not small. So 6 to 10 p.m. is our most popular time, sometimes stretches to 11 p.m. at night. And so on CORIA, you can just directly message the provider, and we're the intermediary. We'll hide the message. You get no contact information for either side, and then they decide when to self-reveal and pursue the match, right? So just thinking about, you know, and these are all things like data privacy, data protection, ease of use, like, you know, and people just don't want, honestly, to like build those things sometimes for our communities because you can't extract double-digit investor returns on them, right? So it is really like, you know, I mean, it's all of these little things that add up, I think, to the big win. And just being really attentive to that has been really important. And especially right now when people are triply taxed with anything that they're trying to get done.
Thank you so much. And I had one last question for Kelly. I remember when we were talking, you mentioned that one of the biggest hurdles, and I think we can use this example and through all three panelists, what we were talking about today is how you kind of bring people along. So can you share a little bit about the training that was provided that helped people start to think about at the workforce boards more holistically about their job seekers?
Sure. Sure. So outside of what we attempted to provide, which was just taking some of the best practices and lessons learned on rethinking how to support families and recognizing that it was a systematic change. It is not a project, it's not an initiative. You really have to integrate how you choose to support working families. And so with that, we made sure that we addressed the leadership and buy-in, the partnerships, the stakeholders, and we also talked about engaging employers and creating the network of support. In addition to that, one of the things that we recommended is a family-centered coaching training out of the Prosperity Agenda. They're based out of Seattle, Washington. And basically that training walks different agencies and their staff through how do you really support parents? How do you really get down to some of those questions, their real needs, and make a systematic change in order to really evaluate not only your services, but also how you interact with them, being mindful of that. And so, again, the Prosperity Agenda's family-centered coaching, it is what the Maricopa County Workforce Development Board and the Health and Human Services, they utilized that coaching and went through the process to really get their staff up to speed on better supporting parents. As again, sometimes you get a little tunnel focused and you think, job placement and not recognizing that this person is a whole person. They come with a whole family that requires necessary supports. And so in order for that person and that family to be successful, you have to address those things. And so family-centered coaching from the Prosperity Agenda really does walk an organization and their staff and leadership through the steps that are necessary in order to have a more holistic approach to the work.
Thank you so much. Yeah, just so in case you were looking for some additional resources, that might be one, some of us want to check out. Well, I just wanted to thank all of you for joining us today. I'm so grateful to Dr. Williams, Callie, and NIHDI for their time and expertise. As a reminder, there are 2 additional webinars in this series. Please register for them in the link provided in the chat. For those of you who have asked, this has been recorded. You will receive the link tomorrow, along with a survey that we really hope you'll fill out, because we want you to continue to be engaged in this ongoing initiative. And that includes on-the-ground engagement with local partners as we move this work on a more regional basis. As well, just so you know, for the next 2 topics, we are first on October 15th, covering childcare as a community investment. And on October 22nd, how to integrate childcare into housing and other community facilities. Both of those are at 12 p.m. Pacific, and we really hope to see you there. Thank you guys so much for joining us today, and it was a great conversation and really enjoyed it.